Do you remember that painful breakup that left you heartbroken? Can you remember when you found out that you had failed that exam? And what about that nasty thing your classmate had said about you in high school? My name is Inga Murray, and in my work as a psychologist, I witness how experiences from the past shape us. We store past experiences in the form of memories, and these memories may have an emotional meaning to us, so that's why we call them emotional memory. Emotional memories can be positive or negative, and they shape the way you perceive and interact with the world around you. Say you've been bullied in high school, for example. This can make you feel more insecure and introverted later in life. And sometimes such negative experiences lead to a higher chance of having a mental health condition, like a depression, anxiety, or an eating disorder. Would you have guessed that 1 in 4 adults suffer from a mental disorder in the world? That is more than the whole population of China, the most inhabited country on Earth. But did you also know that the success rate of current treatment is only a mere 40%? This raises an important question of what can we do to improve these numbers in order to ease psychological suffering of our society. Psychologists have spent decades of research in hopes of finding underlying factors that cause or explain why we have mental disorders. But in fact, this research has not been very fruitful. So perhaps a new perspective on mental disorders can offer insight. A new way to look at mental disorders, like depression, is as a network of symptoms. If you look at symptoms of depression, for example, having trouble sleeping can cause you to not focus on your job or studies the next day, which may lead you to feel guilty or worthless. And these worries may make it even harder to fall asleep again that night. As you can see, this can become a perpetual cycle where symptoms can remain activated for weeks, months, or even years. So how does emotional memory fit into such a network? That is exactly what I want to answer in my research. I want to find out what exact role emotional memory plays in mental disorders. We've all gone through a breakup or failed an exam, but why do some people struggle with mental health and others do not? Can emotional memory trigger a cascade of symptoms? And if so, how can we intervene on this to break that cycle? With my research, I hope to find a way to break these negative cycles so that our patients can feel better again. Thank you for your attention.